Facelift can be done in two different ways. The traditional way is surgical facelift, when it's done under general anesthesia and can be associated with some complications, including hypertrophic or keloid scar, which usually happens in around 20% of patients having the procedure, especially if you are with darker skin type or with Asian or Afro-Caribbean background. Complication after general anesthetic would be much more than doing the procedure on the local. That's including risk of surgery such as infection, bleeding, and quite long downtime, which could be from days to weeks and even months. Also, because of the significance of the procedure, there is a higher risk of thromboembolic event after the procedure. Surgical facelift cannot be always successful, and if it goes wrong, the correction is not that straightforward. If you are under 60-year-old, definitely it's not a perfect option for you to start. The second way of skin lift or facelift is using laser, and it's quite recent method and getting more and more popular. It's using the laser, approaching the skin from underneath to warm it up and start the process of new collagen formation and removing a small amount of excess fatty tissue. It can be used on different parts of the body in addition to face and neck. It's not a skin surgery, so it doesn't need any cut to the skin. So in fact, we don't have any concern about risk of skin surgery such as scarring, infection, bleeding, and significant pain after the procedure. The downtime is very short, and many patients can go to work on the same day. Most people will notice the change in their skin tone soon after doing the procedure. It's the first choice for younger population, especially if you are middle-aged or around 60 to 70 years old. The maximum results will be noticeable after 6 months. However, majority of patients need just one treatment. And usually, especially if you combine it with other modalities such as injectables, that would be fantastic approach to make your face younger. And it's not just for your face and neck. In addition to significant impact on your lower jawline, around the eyes, if you have sagging skin on the chin area, it can also work on many other places, including loose skin underneath your arm and also on lower body, such as around your knee joints, and if you have cellulite in your buttocks area. Even in older age group, many of our plastic surgeon colleagues prefer to have it before going for surgical facelift, because combination of other elements with this revolutionized treatment would work fantastically well to satisfy patients. In my clinic, we perform the whole procedure by a dermatology consultant, and we do all the necessary assessment and all the precautions during the procedure. For example, if you are approaching some sensitive area or high-risk area, we performed ultrasound examination of the skin to avoid any damage to the skin or any tissues underneath.